All right, welcome in everyone. Ready for another deep dive.
Ready when you are.
Awesome.
Yeah.
So today we're going to be looking at something called mindfulness-based cognitive therapy,
Okay.
MBCT.
MBCT. Yeah.
And the material we're going to be drawing from today is, well, it's pretty straightforward,
Okay.
called pasted text. Yeah, I mean, no fancy titles or anything, but from what I've been reading so far, it's got some pretty interesting stuff in it about, how mindfulness can actually be used
Right.
to help manage those kind of tough thoughts and feelings we all get sometimes.
Mm-hmm.
So I guess the mission for today's dive is to kind of unpack what MBCT is all about, how it works, and, if it actually lives up to the hype.
Yeah, absolutely. And I think it's important to start off by saying, a lot of folks, they hear mindfulness and they think, oh, okay, that's just about, like relaxation and chilling out.
Yeah, like a meditation app or something.
Yeah, exactly. But MBCT, it's more than that, right? It actually combines mindfulness with some of the techniques that we use in cognitive therapy.
Oh, interesting.
To really help people, work with those kind of like recurring difficult thoughts that can really kind of drag people down.
So can you give me an example? Like what kind of thought patterns would MBCT actually be helpful for?
Yeah, sure. Think of someone who's, they're always worried about failing, right? Even when they're succeeding, they're convinced that something bad is going to happen.
Oh, yeah. I know a few people like that.
Right. Or someone who's constantly criticizing themselves no matter what they do.
That inner critic, yeah. It can be relentless.
It really can. And that's exactly the kind of thinking that MBCT aims to address.
So it's almost like, MBCT gives you tools to kind of break free from those mental traps.
Exactly. It's not about, eliminating thoughts or feelings altogether, because that's not realistic.
Right.
But it's about learning to relate to them differently.
Okay. I like that. So how does that work? How do you actually change your relationship with those kind of thoughts?
So in MBCT, one of the key things we learn is how to observe our thoughts and feelings without judgment.
Okay.
Kind of like watching clouds drift by, They're there, we see them, but we don't have to get caught up in them.
That's a really interesting image. So I'm picturing like you're sitting there and you've got this thought that's kind of negative or whatever, and you're just kind of watching it go by like a cloud.
Yeah, and that allows us to create some space, right? Space between ourselves and our thoughts so we don't automatically buy into them.
Okay, I see. So less reacting, more observing.
Exactly. And that space, that's where we can start to make choices.
Okay, so this is all sounding very conceptual, but I'm curious about the practical side.
Yeah, sure.
Like, what does an MBCT program actually look like? Like, what do people actually do in those programs?
Well, typically it's a combination of things, right? So you'll have guided meditations, maybe some gentle yoga, and then also group discussions.
Oh, okay. So it's not just you, like, sitting by yourself, meditating in silence.
No, it's definitely an interactive process.
That makes sense. And what about specific techniques? Are there any particular exercises that people learn?
Yeah, definitely. So one of the really common ones is called the body scan.
Body scan. Okay.
And it's basically what it sounds like, right? You systematically bring your attention to different parts of your body.
Oh, interesting.
Starting with your toes, maybe moving up to your feet, your legs, just noticing any sensations that are present.
So it's kind of like a way to become more aware of your physical self.
Exactly. And it can be really helpful for grounding yourself in the present moment.
Okay, that makes sense. I can see how that would be helpful for stress, just kind of getting out of your head and into your body.
Right. And another common technique is mindful breathing.
Mindful breathing.
Yeah, so you're focusing on the sensation of each breath as it comes in and goes out.
Oh, okay. So like really paying attention to like the rise and fall of your chest.
Yeah, the feeling of the air moving through your nostrils, just really being present with that experience.
I mean, I know breathing is important, but it seems so simple. Like, how can that actually help with something like anxiety or depression?
Well, it's about more than just the breathing itself, right? It's about using the breath as an anchor to bring you back to the present moment.
Okay.
Because often when we're struggling, our minds are either stuck in the past or worrying about the future.
Yeah, I can definitely relate to that.
Right. And so by focusing on the breath, we're training ourselves to come back to the here and now.
Okay, so that's where the mindfulness piece comes in. I'm starting to get it.
Yeah.
But I'm still curious about the cognitive therapy part.
Sure.
Like, how does that fit in with all this mindfulness stuff?
So the cognitive therapy aspect is really about helping us identify and challenge those unhelpful thought patterns we were talking about earlier.
Okay, so like the constant worrying and the self-criticism.
Exactly. And some of the common patterns we see are things like catastrophizing, which is, assuming the worst will always happen.
Right.
Or black and white thinking, which is seeing things as all good or all bad.
Oh, yeah, I do that one a lot.
Right. So in MBCT, we learn to question these thoughts, to look for evidence that supports them or doesn't support them. And ultimately, we start to develop more balanced and realistic perspectives.
Okay, so it's kind of like you're learning to be more objective about your own thoughts.
Precisely. Instead of just accepting them as truth, we start to see them as just thoughts, mental events that come and go.
That's really interesting. So it sounds like MBCT isn't just about like relaxation or feeling good. It's about actively reshaping how we think and react to the world around us.
Absolutely. And while a lot of the, research and attention on MBCT has focused on preventing relapse and depression, the benefits can really extend to managing general anxiety and stress as well.
That makes sense. I mean, so much of our suffering, it seems like it comes from those automatic negative thoughts.
Yeah.
So if MBCT can help us kind of interrupt those patterns,
right,
it seems like it have a huge impact on just our overall quality of life.
I agree. And, one of the things that I've seen with my patients who've gone through MBCT is that they develop this ability to step back from their anxieties and just kind of observe them.
Oh, that's amazing. Can you give an example, like a specific person who's really benefited from MBCT?
Yeah, sure. I had a patient, she was a lawyer, and she was constantly worried about her cases, really stressed out. And through MBCT, she learned to kind of create that space between herself and her worry. It wasn't about eliminating the worry altogether, but it was about changing her relationship to it.
So she could still do her job, but the worry wasn't controlling her life anymore.
Exactly. She was able to be present with her work and with her family without being constantly overwhelmed by anxiety.
That's so powerful. And I think that's a really important point, that MBCT isn't about achieving some like unattainable state of perfect calm.
Right.
Or never having negative thoughts again.
No, not at all.
It's about developing a more resilient way of being in the world.
It really is. It's like building a toolbox of skills that you can use to navigate the inevitable ups and downs of life.
Yeah, that's a great analogy. And speaking of ups and downs, depression can be a really, really tough thing to deal with. And I know there's a lot of research on MBCT and its effectiveness in preventing relapse.
Yeah, and it's pretty compelling, actually. Some studies have shown that MBCT can be as effective as medication in preventing relapse for certain individuals.
That's really impressive. So as we kind of wrap up our deep dive today, what's the key takeaway here for our listeners?
I think the most important thing is to consider how bringing awareness to your breath, your body, your thoughts, even for just a few moments each day, might shift your perspective.
So kind of like a little experiment.
Yeah. Just notice what happens when you start paying attention to those things. And ask yourself, could cultivating this awareness, the kind of awareness we practice in MBCT, contribute to greater emotional resilience in your own life?
That's a great question to leave our listeners with. I know I'm going to be pondering that one for sure.
Me too. It's a lifelong practice,
Yeah, and it's a practice that can really make a difference.
Absolutely.
So thanks for joining us today for this deep dive into MBCT. We'll be back soon with another fascinating topic to explore. Until then, take care.
Take care.